The whole thing began right in the middle of lockdown. I had a long day looking after the 2 children, and I was sitting in the bath with my little girl, just kind of daydreaming, and suddenly just felt a lump on my breast. And I remember my first thought was, I'm not going to go and get this checked out because we're right in the middle of COVID and it's probably nothing. And then calling my husband and saying, what do you think? And at which point he said, we've definitely got to go and get this checked out. I had an ultrasound, I had a mammogram, and then before I knew it, they were taking biopsies, and there was talk that it might be a tumour. Emotionally, it just tears you into absolute pieces. Just watching everything you've built in your life get shattered in one blow. I've got 2 young children. How long will I be here for them, and will I see them? Will I see them growing up? Will I see them get to nursery, let alone to primary school, to secondary school? Yeah, just so much races through your head, and yeah, you don't even know where to begin. When I got told I had cancer, those words just ring in your ears. But then suddenly there was a plan in place that actually, as horrific as everything is, suddenly then you're into a kind of a plan and a journey. You're on a pathway where the chemotherapy starts.
Every person we look after with cancer is unique. Their tumour is unique, they are unique, and they need a unique and personalised treatment. When people come to us, what we have to deliver is the best treatments, the cutting-edge treatments.
From the latest diagnostic and surgical capability, patients have access to leading consultants and cancer therapies, which include chemotherapy, immunotherapy, radiotherapy, and clinical trials. Where necessary, genetic profiling is used to help inform which care is most appropriate.
Chemo day, it is quite long. This morning I arrived about 9:30. There'll be an hour of this drug going through, then an hour of the second drug going through. So I'll probably be here for at least 5 hours. And I suppose Brian has been my nurse for many of the sessions, and we've really built up a rapport.
We offer the full suite of wellbeing support therapies that are available both here at LOC and virtually. Patients have a dedicated clinical nurse specialist with them throughout their treatment. Someone who can explain complex clinical information and help them manage their concerns.
First time I met Esther, she was super tense and super anxious about coming for treatment, especially with the way things are at the moment with COVID. We are quite lucky here, especially that we do have the time to spend with our patients to give them that extra support, which everyone needs right now, and especially trying to go through a cancer diagnosis and coming in here without your relative or friend. It is good that we can be here as nurses to help support them.
The vision of the LOC, when we conceived of putting this together, was to create a setup and an environment which, in the first instance, provided people with the best possible standard of cancer care, but also focused on the whole patient, made them feel like an individual person, made them feel cared for, made them feel that they mattered, made them feel that people were focused on all their concerns.
We're like a family, working together in the same way perhaps like an orchestra is composed of lots of musicians, all with their individual expertise, but working together, playing together to make sure we always hit the right notes.
One of the hardest things with cancer is what it takes from you emotionally, but also very physically. I have always had long blonde hair, and I have loved having long blonde hair all of my life. To find yourself with no hair and knowing at some point that you might lose your boobs as well, that it is very, very hard. The care at LOC has been, I think, out of this world. When you come in, there's a calmness that sort of sits over this place, and there's already tremendous progress. My lump has shrunk to, has actually vanished from scans. So I now can see that there might be an end point, and there might be a point when, I don't know, hopefully get on with my life again rather than just being defined and all consumed by cancer, which is what it has been for the last few weeks and months.
Cancer is a very personal experience for you and your family. So we tailor our care for your individual needs. Our wellbeing therapies provide a holistic approach, supporting patients' physical, emotional and wellbeing needs.
it's definitely lots of steps in the right direction now. There is everything still to play for. There's a lot of hopes and dreams and things that I still have on my very, very long to-do list, and that hasn't got any shorter.